is Stand Up to Cancer 2025!
On a 5-hour show tonight dedicated to those who have or will get cancer and the treatments for it, there was a 5-minute video message from one cancer patient who also happens to be king.
I know from my own experience that a cancer diagnosis can feel overwhelming. Yet I also know that early detection is the key that can transform treatment journeys.
The King's cancer diagnosis was revealed in February 2024. He's been having treatment for it ever since. But in a new message tonight, one that might perhaps inspire others or even give some hope, the 77-year-old said this.
Indeed, today I am able to share with you the good news that thanks to early diagnosis, effective intervention and adherence to doctors' orders, my own schedule of cancer treatment can be reduced in the new year.
He called it a personal blessing, and his cancer journey is one that has taken him to a number of cancer wards where he shared his experience and listened to others explain theirs. But he said, it troubles me deeply that 9 million people in the UK could have a screening, they are eligible for one, but have not taken it up.
That could be 9 million opportunities to catch cancer early. That's why we've developed the National Screening Checker, and we want people to check whether they're eligible for screening, because catching cancer early means many people will survive cancer longer.
The King's most recent public engagement was on Wednesday, an Advent service at Westminster Abbey. So what does this news mean for him next year? Less cancer treatment means fewer visits to hospital, fewer side effects, and therefore, with his doctor's blessing, potentially more work for a monarch who likes to work a lot. But the message tonight was about early diagnosis. As the King knows, it saves lives.
As I have observed before, the darkest moments of illness can be illuminated by the greatest compassion. But compassion must be paired with action. Your life, or the life of someone you love, may depend upon it.
Cancer screening, the King said, is a minor inconvenience that could lead to life-saving intervention. And his intervention tonight might just have saved the life of someone watching or reading about his own news.
And Chris joins me now to talk a bit further about this. Clearly a positive message tonight from the King, but what do we make of it in terms of looking ahead and what this might mean for his future treatment and indeed his future carrying out of his duties?
Well, look, firstly, what I will say is actually I thought it was a very personal message. I think you did too when you were watching it, because often Buckingham Palace would say to us, oh, the King's going to make a very sort of personal reflection on his own cancer, and then it's a very brief mention while he tries to sort of steer the focus away to something else. He's not very comfortable about talking about himself, but look at some of those words tonight. The diagnosis was overwhelming. It was a personal blessing that he's been able to reduce his cancer treatment, and it troubles him deeply, as he put it, that 9 million people, I mean, that's a lot of people that are eligible to get the screening and don't currently take it up. So on that point, it was indeed very personal. To answer your question about what it means for next year, well, look, we know this King is a workaholic. In fact, we've heard Queen Camilla say in public a few times the trouble with him is he won't slow down. And actually now having this green light for the doctors to do even more, he's going to take that opportunity to do it. It probably means that on things like, like a royal tour, for example, you might remember last year when we went to Australia and Samoa, he had to tell New Zealand, sorry, can't do that, that's too much. It just now means that he can do more things, both at home and abroad. There is some rumours around that there might possibly be a trip to the United States next year, a return trip to see Donald Trump. It's also America's 250th anniversary. I'm not saying that will happen, but what it means is having this green light from the doctors simply means he can do more things and fit more in the schedule.
OK, we'll see what the new year brings. Thank you very much indeed, Chris, for all of that. Thank you.
This is a season when our thoughts turn to celebrations with our friends and families. In the midst of this festive period, I just wanted to ask you to join me today in finding a special place in your hearts and your minds and prayers for the hundreds of thousands of people across our United Kingdom who receive a cancer diagnosis each year, and for the millions more who love and care for them. I know from my own experience that a cancer diagnosis can feel overwhelming. Yet I also know that early detection is the key that can transform treatment journeys, giving invaluable time to medical teams and to their patients the precious gift of hope. These are gifts we can all help deliver. Throughout my own cancer journey, I've been profoundly moved by what I can only call the community of care that surrounds every cancer patient. The specialists, the nurses, researchers, and volunteers who work tirelessly to save and improve lives. But I have also learned something that troubles me deeply. At least 9 million people in our country are not up to date with the cancer screenings available to them. That is at least 9 million opportunities for early diagnosis being missed. The statistics speak with stark clarity. To take just one example, when bowel cancer is caught at the earliest stage, around 9 in 10 people survive for at least 5 years. When diagnosed late, that falls to just 1 in 10. Early diagnosis quite simply saves lives. Now, I've heard this message repeatedly during my visits to cancer centres across the country. I know, too, what a difference it has made in my own case, enabling me to continue leading a full and active life, even while undergoing treatment. Indeed, today I am able to share with you the good news that thanks to early diagnosis, effective intervention, and adherence to doctors' orders, my own schedule of cancer treatment can be reduced in the new year. This milestone is both a personal blessing and a testimony to the remarkable advances that have been made in cancer care in recent years. Testimony that I hope may give encouragement to the 50% of us who will be diagnosed with the illness at some point in our lives. Yet, too often, I am told people avoid screening because they imagine it may be frightening, embarrassing, or uncomfortable. If and when they do finally take up their invitation, they are glad they took part. A few moments of minor inconvenience are a small price to pay for the reassurance that comes for most people when they are either told they don't need further tests or, for some, are given the chance to enable early detection with the life-saving intervention that can follow. This is why I'm so encouraged to learn about the new national screening checker that is available online. This simple tool allows you to check whether you are eligible for breast, bowel, or cervical cancer screening. It demystifies the process, answers your questions, and guides you towards taking that crucial step. As I have observed before, the darkest moments of illness can be illuminated by the greatest compassion. But compassion must be paired with action. This December, as we gather to reflect on the year past, I pray that we could each pledge, as part of our resolutions for the year ahead, to play our part in helping to catch cancer early. Your life, or the life of someone you love, may depend upon it. Therefore, this brings my most heartfelt thanks to the doctors, nurses, researchers, and charity workers involved in diagnosis and treatment programs, together with my particular good wishes to those for whom they care so selflessly.